I'm Dr. Chichkova. I'm professor in neurology and neuromuscular medicine and internal medicine at the University of South Florida in Tampa. Tampa is on the west coast of Florida. We were talking about the hurricane. No, we didn't get hit. There was actually less rain than what we usually get every day in this time of the year. All right, so first of all, I want to express my gratitude to Soleo. Soleo is an infusion company. I work with this infusion company, I work with them. They do infusions of IVIG to my patients. So they were the ones who sponsored my coming here and this lecture. So I really thank to them and for their partnership. And I also understand they they're one of the sponsors for this event. So with that, I want to start. First of all, I'm Bulgarian, and I'll give you some slides, some information about my country, just to diversify a little bit the topics. I have an accent, as you already noticed. If there is something that you do not understand, I didn't clarify enough, please let me know right away. I was asked at the beginning, do I like questions in the end, in the middle? I don't care. You can do whatever you guys want. If you want to ask in the end, I'll stand here for some time and answer questions privately. If you want to ask in front of everybody, that's fine with me too. And I'll answer to my best ability. How about that? Also, another thing is that I'm a clinician. I'm not a researcher. I do not do studies with animals, or I treat patients at Tampa General, University of South Florida, and I also take care of the veterans at the James A. Haley Veterans Hospital. So have the very diverse population. So I was asked to do a topic on overlapping diseases, and these are the topics that I'm going to cover: systemic sclerosis, Scleroderma Overview, Rheumatoid Arthritis, Lupus, mixed connective tissue diseases, and Raynaud syndrome. So I promised to give you some information on who I am, and actually this is not working. But here is Bulgaria. Bulgaria is in Europe, on the Black Sea. Very old country, more than 13 centuries old, never changed its name, never lost a flag in a battle. So I'm really proud of it. So Scleroderma is the first topic that I'm going to cover. And not only France, by the way, is famous for the lavender, we also have valleys of lavender. Not only Turkey is famous for the roses, we have beautiful valleys of roses. And in the spring, in the early summer, spring, you can see on one side of the roads valleys of roses, and on the other side later on lavender, so it's really beautiful. So these are pictures from Bulgaria. Scleroderma is a rare disease that actually involves, what it does is it causes hardening of the connective tissues. And as such, you can see the different features of scleroderma. It may affect only the skin of these patients, and it becomes harder, tighter, it can cause some discomfort, but in some patients it also affects other structures, so like the blood vessels, internal organs, particularly the digestive tract, and they can cause more just that discomfort of having tighter skin. Women are more affected than men. Usually they're in this earlier age, I consider between 13 and 15 young women, not in their teen years or in their 20s. There is no cure, but there are medications that would modify the disease. As you know, we hear about conditions that we may not be able to cure, but we can modify by using different disease-modifying medications, as we call it. So the skin is part of what scleroderma may involve. Usually it is affected in the majority of the patients. It may also be in patchy areas, so not all skin could be affected, but only here and there. It becomes really shiny. Because of these restricted movements that the patients may have, they can develop contractures. So in other words, the fingers can stay or the hands can stay in one position, and it could be difficult for the patients to execute fine actions. There could be also calcium deposits under the skin. Now, the tightening of the skin of the face can cause kind of decreasing the size of the mouth, and this could cause also difficulty opening the mouth and conceivably difficulty with feeding, of that matter. There's also the dry mouth, and the dry mouth can create problems with dental care, with and causes dental decay. Raynaud phenomenon is another problem that patients may experience with the skin. And this is, as I'm showing here on the slide, this change of the color of the fingers, particularly in cold weather. So here in this climate in the north, of course, this becomes a problem. It's a problem also in Florida because outside it's maybe 100 degrees, but you go in the office and it's 65 degrees. So I have friends actually who have Raynaud's. They have to wear gloves when they're working in the offices in Florida. That could be an early sign. Not only temperatures, but also emotions could provoke the symptoms of Raynaud's. And the skin could be first white because of this vasospasm, and later on with warming up, it can become super red, even livid, as you see on the slide. Now, it should be known that not only in scleroderma you can see Raynaud phenomenon. It could be, and I'll speak later on separately about Raynaud. But if the vasospasm, and this is, vasospasm means the blood vessels actually get closed. Because of the closing of the small blood vessels, if it is very severe, it can block the blood supply to the fingers, let's say. Not only fingers, but different areas that have less blood supply, like nose or ears. It could be so severe that even it can cause gangrene, dying of the tissue, and gangrene in extreme situations. I'm not saying about every patient is going to have that. Digestive system can also be affected in scleroderma, and that could cause more serious than the skin problems. Folks may have acid reflux, and this acid reflux creates a lot of irritation in the esophagus because the esophagus is not designed in a way to handle that reflux. The stomach is, but not the esophagus. And that irritation may cause esophagitis, erosive esophagitis, indigestion, and whatnot. The hardening of the tissues also causes decreased motility of the GI tract. It also can, and the decreased motility, of course, if the purpose of when you swallow the food, the motility helps push the food further down the gut, but that could be a problem with scleroderma. Now, the fact that there is decreased motility, the acid reflux, the hardening of the walls may cause malnutrition. And malnutrition is a major problem in folks who have problems with swallowing or with the GI tract. Because if you have discomfort, you kind of try not to eat that much, but that not eating that much creates this deficiency not only in food and the building elements of your body, but also vitamins, minerals that are very essential in different functions of the body. It's very important to recognize this GI, the problem with swallowing, with the malnutrition early on. And patients may say, excuse me, oh, I had my swallowing study last year or 2 years ago. It doesn't matter because things could change over time. They could get better, they could get worse. So that's why as long as one starts experiencing swallowing problems, not only related to scleroderma, but in general, because sometimes folks with myositis can also have problems with swallowing, they have to have a swallowing evaluation for updating the recommendations that they may be given. Also, folks who have trouble with swallowing and this reflux, it's better to elevate the head of the bed at night so that by gravity the juices don't come up to the esophagus but run further down. And also don't eat very late. let the food go through, and then go to bed kind of a relatively digested food situation. Why is it important to address swallowing difficulties early on? Because there could be consequences, and these consequences could be more serious. And that's why we want to prevent. Prevention is very important aspect of medicine. It's not only, oh, we will take care of the problems once they occur, but the prevention is what will make the major difference. So number one problem when people have difficulty with swallowing is aspiration. And aspiration, as you may know, the mouth is the dirtiest place. It's not the other end, it's the mouth. Because here are all kinds of bacteria, including bacteria that we call them anaerobic, meaning they don't need oxygen at all to live. So when you aspirate this saliva and it goes to the lungs, actually these pneumonia, they could cause pneumonia, and these pneumonias are usually nasty pneumonias. Not to mention that aspiration in pneumonia is the #1 cause of morbidity and mortality in hospitalized patients. So it's very important to prevent it and address it. It could cause asphyxia, meaning you can't breathe and you can choke. Now with prolonged, when there is a prolonged problem with swallowing, there could be areas of enlargement of the esophagus, or there could be also strictures. Unfortunately, my light does not work, so I have to show you. So strictures meaning narrowing of the esophagus. And when there is narrowing above, it's like a pipe. Imagine it's a bag and you put more stuff, it gets kind of enlarged up top. So it causes not only the function, but also the anatomy of the entire system. And ulcers, of course, can occur. And here, you don't need to be a radiologist to see that there is a big problem right here, and this is an example of aspiration pneumonia. Now, heart could also be affected because of this accumulation of the connective tissue. We need the connective tissue, of course, but too much of it is also not good. Everything in the human body needs to be balanced. Now, when the heart has more connective tissue, of course, there is less chance of these chambers to be filled with blood. And you need this blood, sufficient amount of blood, so that it could be sent further to the brain, to the rest of the organs in the body, to the aorta. It could, the decreased, what we call ejection fraction, or amount of blood that is sent out meaning outside of the heart, we call heart failure. And it could be different grades depending on how much that function is affected. And there are medications that could address cardiac failure, and there are things and diets that we need to do to actually limit the burden to the heart. There's also spasm that can occur in the blood vessels, meaning they may not necessarily be blocked by atherosclerosis or build up, but they could spasm, and that spasm could cause chest pain, and of course, if severe and long enough, heart attack. It's a similar phenomenon, just like with the fingers that I mentioned earlier, the Raynaud phenomenon. Also, there could be inflammation, and depending on where that spasm occurred, patients may develop arrhythmia. And arrhythmia, you may know that part of the heart actually is the pacemaker, the natural pacemaker that gives the kind of the rhythm of the heart to beat. You know about people who have external pacemakers. But if changes occur in that pacemaker, that is the reason why folks would develop problems with arrhythmias. That's why anytime when a patient has shortness of breath, for example, with minor exertion, it may not necessarily be the lung, it could be the heart, swelling of the legs, darkening of the, we call it cyanosis, like bluish discoloration of the legs, of the fingers, mouth, having to sit in bed because of shortness of breath. These are all signs that require evaluation by the primary care physician, of course, and primary care physicians, depending on their comfort level of dealing with patients with cardiac symptoms, they may treat you or they may send you to a cardiologist. The lungs, similarly, buildup occurs, connective tissue occurs in the lungs that could restrict now the function of the lung, because as you know, the lung expands when we take a deep breath. The lung expands, fills with air. That air contains oxygen, and the blood that runs through actually picks that oxygen and carries it everywhere in the body. So when there is connective tissue that sits there, that restricts that function of oxygenating of the blood. And that could impair, that could also cause shortness of breath. That is called also interstitial fibrosis, pulmonary fibrosis, and interstitial, similar to interstitial lung disease that can be also seen in myositis. That could create pulmonary hypertension, meaning the lung is having, it's kind of a compensatory mechanism. There is big pressure inside the lung, so it's much harder for the heart to push the blood towards the lung to get the oxygen. So it creates a problem with the right side of the heart. Right heart failure. Again, shortness of breath, cough, decreased exercise tolerance, similar complaints as the ones if a patient has heart condition. But as you can see, everything in the body is connected. Because if somebody has a long-standing lung disease, and here I'm not talking about pneumonia or bronchitis, that may affect the heart, and vice versa. If somebody has problem with the heart, that could cause problem with the lung. And as a result of everything, because the heart sends the blood everywhere, other organs will suffer if there is not enough blood supply to the other organs, or if there is blood that does not have enough oxygen, goes everywhere in the body. So what's important then? There are things that we can do for ourselves. Number one is quit smoking, because this is what I have problems with patients sometimes, even with my own husband as well. Quit smoking, because this is one thing that we can do for ourselves. Nobody, we as doctors, we can give medications, we can do this and that, but this is one thing that patients can do for themselves, because smoking is a major risk factor for cardiovascular disease, strokes, and many other things, including if somebody has lung problem. Avoid air pollutants, so that's easier said than done, because if you live in a big city, the exhaust and everything, that's unavoidable. Breathing exercises and aerobic exercises are good. Just inhaling on purpose, walking outside as much as you can, being outside, breathing fresh air, and then evaluation by cardiologists, pulmonologists, chest x-rays. Echocardiogram is another test that can evaluate heart function, which is an ultrasound of the heart. It's not dangerous, it's not radiation, it could be done as many times as necessary. Pulmonary function tests are the official function test where they ask the patient to blow into special equipment and determine what the volumes in the heart are. And of course, CT, X-rays or CT, computer tomography of the lung to find in details further problems. Kidneys and genitals can also be affected because some patients may have high blood pressure, so that high blood pressure affects the kidneys. You know that patients who have chronic, who have hypertension may develop eventually kidney disease, and the kidneys are the ones that, if they don't work properly, they spill proteins in the urine, and that creates a lot of disbalance in this electrolyte and protein absorption and clearance. Acute kidney failure is a medical emergency, and that will present clinically with somebody who, let's say, normally goes to the bathroom to urinate, and all of a sudden they're not urinating. So that's, and I'm not here talking about, oh, you went to the beach and you're sweating because this will decrease the urine output. But I'm talking about, okay, I go like 5-6 times a day, and I haven't been even to the bottom. So that's a very alarming sign. With that, and that cannot last for a long time, because the kidneys also clear the toxins from the blood. So if these toxins accumulate, patients may start having headaches, they may even have seizures, confusion, and all that. So we should monitor the different things that come out from us. That's why I tell the patients, when you pee, look what's happening in the front, look what's happening in the back. So you have to monitor those bodily functions. And of course, monitoring of blood pressure, urine, kidney function with the primary care physician, particularly, now if it is normal, then you can relax a little bit. But when we age, I mean, not we, when men age, also the prostate problems kind of come on top. So that could create additional problem. Follow up with primary care physician or nephrologist. Sexual dysfunction could be an issue. Problem with erection, or problem with females, also problem with lubrication, and also tightening in that area. So constricting of the vagina could be a problem. Now muscles. Now since we are in a myositis conference here, in scleroderma, in about 15% of the patients there could be muscle weakness also. So that's why we're talking about these overlapping diseases. And as you know, these patients who have myositis, it's proximal muscle weakness, like we call the chair sign, difficulty getting out from a chair, blow drying hair, walking upstairs. Usually within 6 years of onset, often is non-progressive, but patients don't read the textbooks. There could be variability in the presentation. Men more frequently affected than females. People who have other organ involvement are more likely to have involvement of the muscle than people who have only skin affected. And there are different types of antibodies that we can test, but keep in mind there is no single test that we can do and diagnose a particular disease of these overlapping diseases. If we put a needle in the muscle, like you know, this is the EMG, electromyography, we hear and see the myopathic, meaning damage of the muscle findings. The serum creatine kinase could be elevated in various degrees. If we do muscle biopsy, it may not be very well defined. In other words, there may not be convincing findings and features, but if we, like I said, there is no single test that we can do. It's the diagnosis, like I always teach the students and residents, look at the patient as a whole, not as a single test. Because eventually the tests are our slaves. We are not the slaves of our tests. You see what I mean? And we treat it with the typical medications that are immune suppressants, the steroids, the cyclosporin, methotrexate. All right, so let me kind of change a little bit. So Bulgaria is famous for the yogurt also, and the that bacillus that is in the yogurt and makes the yogurt is called Lactobacillus bulgaricus. This is where it comes from. And here I'm showing you a summer soup. It's called tarator. Very refreshing soup. Funny enough, in Korea they have a similar soup, believe it or not. But where's Bulgaria, where's Korea? But see, so we kind of put some water in the yogurt, got cucumbers, walnuts, salt, oil, and dew, and it's a wonderful, refreshing summer dish. All right, Sjogren syndrome is the next topic, and here I'm showing you, Bulgarians also have pipes. See the guy down there, it's a very popular musical instrument in Bulgaria. And also here on the left, it's a tradition before even Bulgaria accepted Christianity in the 7th century after Christ. Prior to that, we have different gods, you know, and in order to chase the bad spirits, this was a tradition. People would dress with those costumes and start running in the cities to chase. Similar to Halloween, actually. It's very similar to Halloween. Not at that time of the year, though. Anyway, Sjogren syndrome, it's an autoimmune disease also. So it affects the membranes that produce the secretions. And these are the eyes, the mouth, of course, the genitals. So patients could have dry eyes. And dry eyes, sometimes people don't know they have dry eyes, but they start hurting because we have to blink. The purpose of blinking is actually to moisturize the cornea. And when we have dry eyes, we have the feeling as if there is sand in our eyes. So that could be damaging to the cornea. Dry mouth, it's hard to speak, and like I said earlier with scleroderma, this could be a reason for dental decay. Dry nose, they also have the more systemic symptoms like joint pain, sweat stiffness. There could be swollen salivary glands here around the face. They could have skin rashes, cough, prolonged fatigue, and Sjogren syndrome could coexist with other autoimmune conditions like rheumatoid arthritis, lupus, myasthenia gravis, and myositis as well. It can develop at any age, but usually these are again younger females that are more frequently affected. What are the common complications? Dental cavities, like I said, yeast infections, not only in the mouth, but also genital yeast infections. Vision problems because the cornea needs to be lubricated in order to function. Otherwise, when it dries, it kind of becomes more opaque and causes blurred vision. And less common are liver and kidney problems, lungs, like similar to the ones with scleroderma. Very small percent of these patients could develop lymphoma, but it's a very small percent. So muscle pain in 20–30%. So we see that like 1/5, even more frequently, Sjogren's patients may have muscle problems. Myopathy in 10%, and now this is inflammatory myopathy is half or more than half of the patients. And what's also typical, and one of the major reasons, in addition to myositis, why we as neurologists see those patients is because they have neuropathy, a very typical type of neuropathy with Sjogren's. And neuropathy causes numbness, tingling of the feet and hands, loss of sensation, and loss of sensation could be presented not only, oh, I don't feel what's happening, but loss of sensation can mean balance problem, because we do not realize that it's subconscious, but when I'm standing here, my brain gets the message that my feet are on the ground, and it's kind of relatively soft because there's nice carpet underneath. When somebody has neuropathy, that message is lost. So that's why patients have unsteady gait, or if they close their eyes, they have no idea where they are, and they may fall. So balance. Loss of balance is one of the signs. We call it a negative sign of damage to the peripheral nerves. How can we diagnose? It's like, once again, there's no single test that we can do. Also, we should keep in mind that many medications can cause dry mouth, many of them. They're countless. So always look at it doesn't mean if you have dry mouth, like I do not. It's because I have Sjogren syndrome, right? There are all kinds of blood test antibodies that we can do. In a Sjogren syndrome, there are specific SSA, SSB, which are more Sjogren syndrome antibodies. There is, as I'm showing here on this image, you can see the redness of the eye, as much as you can see. And this is a very simple test. It's called Schirmer test, where you put those papers, and you can see the production of the tears. And there's certain normal value, and these people actually don't produce the tears. There could be more sophisticated tests like cialogram and measuring exactly how much of saliva is produced or tears, radioisotope. Ultimately, if this diagnosis needs to be established, a small piece of lip biopsy could be done, put under the microscope, and there are specific changes that the pathologists look for and diagnose the disease. Treatment, topical treatment, of course, eye drops, see all these ads on TV, Restasis, you know, it's very, with that beautiful lady with the blue eyes, and many others. Increase the saliva by different medications, pilocarpine and others that I've mentioned there. And then, if patients have arthritis, of course, try with the non-steroidal ones, like Advil, ibuprofen, over-the-counter or prescription ones. More serious medications can be used, like Plaquenil, methotrexate, and other immunosuppressants that we use for other conditions. And of course, if folks have fungal infections, of course, antifungal agents could be used. The surgeons could also do minor surgeries in those ducts, kind of to open them so that they could secrete. All right, we're all hungry, I know that. This is a wonderful thing. I can make it too. It's called banica. It's made out of phyllo dough, eggs, yogurt, feta cheese, of course. Feta cheese also, it's something also very Bulgarian. And even though women could have exactly the same recipe, it never comes out the same. So if there are 4 million women in Bulgaria, you eat 4 million different types of banica. I love mine. So, all right, rheumatoid arthritis. And on this slide, I'm showing a very specific pottery. If I see this pottery, I know it's Bulgarian because of the different colors and the different patterns on it. Okay, rheumatoid arthritis is also an autoimmune condition, like all of these that I'm talking about, and it affects the joints, the skin, the lungs, the heart, the blood vessels. And it is not, and the major thing when we are concerned about it, we have joint pain. Is this osteoarthritis that is usually the one that we develop with aging, with wear and tear of the joints, or this is the rheumatoid arthritis, which is a more serious condition that requires different type of treatment and management. So rheumatoid arthritis affects the lining of the joints, and it causes also erosion in joint and bony deformities. You may have seen folks who have rheumatoid arthritis with deformities of their fingers and hands and other, of course, joints. We have a lot of treatments. I remember when I was in medical school 33 years ago and more, there were no treatments back in my country, and people would die with rheumatoid arthritis at a young age. We had a neighbor who died very young. Now we have treatments. So these treatments so much change the landscape of all these conditions that they're not terminal conditions, in other words. So there is a lot of hope and a lot of possibilities out there. Causes significant disabilities. Women again are more affected. As you can see, women are more affected by autoimmune conditions than men, according to statistics. This time a little bit older age, 40 and 60, but young folks could have rheumatoid arthritis. Children could have also rheumatoid arthritis. And there is increased risk with smoking again, family history, environmental exposures. I found that somewhere that emergency workers from 911, they have higher risk for autoimmune disorders in general. I don't know why, but this is what they're saying. Obesity also is a risk factor. So the symptoms usually, and you can see the deformity of the hands up there, tender joints, particularly the small joints are affected first. Small joints of the fingers, small joints of the toes, they cause stiffness, particularly in the morning. Now, we all have stiffness in the morning, but this is different, painful, traumatic stiffness that they may have. Then it could go to the wrists and the knees, but usually starts with the small joints. Fatigue, fever, weight loss, these are the systemic symptoms that folks with any autoimmune disease can actually have. And it affects many other organs, like I said earlier. Patients, like in every disease, can have different presentations. Some can be milder, some can be more severe than others. And there could be flare-ups. They could be in remission and they could have flare-up. So here, I don't know how much you can see, but with osteoarthritis, you know that it's kind of this is a popular term, bone on bone, because here the cartilage kind of gets bad and eventually they lose it. With rheumatoid arthritis, it's actually the synovial membrane, the tissue around the joint is being inflamed, and it causes bone erosion of the bones of that joint. So that's where the difference is, the inflammation. The folks who are on medications, so I'm talking about the complications here, medications that are used for rheumatoid arthritis could also cause osteoporosis, so that, as you know, all medications give you some side effects, so this could be a side effect. They could develop bumps on the tissues around the pressure points, dry eyes, dry mouth, infections. Again, many of the medications are immunosuppressants, and immunosuppressants make you more susceptible to infections. Compression of nerves. Very common complaint is carpal tunnel of patients with rheumatoid arthritis. Muscle weakness, again, these folks could have muscle involvement as well. That could present with myopathic type of pattern, proximal upper and lower extremity weakness. Neuropathies, because of compression of the nerves or inflammation, heart, blockage of the arteries, inflammation of the heart sac itself, lungs similar to others, and there's increased risk, slightly increased risk for lymphoma. Diagnosis, joint pain. It could mimic other diseases, like I said earlier. Not one single death, but that's why the rheumatologist or the primary care physician will do those tests and will do x-rays also. And the purpose of the x-rays is to demonstrate that what I told you is this inflammation around the joint, that synovial membrane, or is it just the osteoarthritic changes that you may have. And then you put things together and look at the age of the patient and the x-rays and the labs, and you can make the diagnosis. Of course, MRIs, CAT scans, and ultrasounds, and EMGs. EMG, if we want, if a patient also has muscle involvement to demonstrate with the EMG, is this muscle only, or with the nerve conduction study, is there also involvement of the peripheral nerves? And as you might know, there are different medications, from the non-steroidal, anti-inflammatory, the over-the-counter, Advil, ibuprofen, all these, to the corticosteroids, to the disease-modifying medications, methotrexate, plaquenil, and then the newer medications, the biologics there are so many out there. You hear the advertisements for all these on TV, Orencia, Humira, Remicade, Rituxan, and many of them. And based on literature, it is the best effect in some patients, of course. The best thing is to use one drug. The best thing is not to use any drugs if you don't need them. But in patients who are refractory, combination between methotrexate and one of those biologics works the best, if needed, like I said. You don't have to do it in combination for all patients. Other therapies, of course, we always look for medications to fix the problem, but we forget that physical and occupational therapies are very important if they are properly done. That's why when I refer for physical therapy or occupational, I tell what I want. For example, if I need to have a problem with balance to be addressed, I tell them I want. I don't just say evaluate and treat. Many times that's not the main problem. And for example, if you have a patient who is in severe pain, that may not be so beneficial to do physical therapy right away. So you may need to address the pain and the inflammation before sending to physical therapy. Because if you are doing all kind of exercises and you suffer for a week after that, that's counterproductive. You don't want to go to have physical therapy anymore. So it has to be chosen at the right time. And usually, depending on what symptoms the patients have, that may require a little bit of workup, like x-rays, to see what's going on before sending the patient to do exercises and therapies that may actually harm them before knowing that. So assistive devices can be used, adaptive tools, because if patients have weakness of the hands, and this also applies to some folks with inflammatory myopathies, you may need to require some assistive devices to eat, to poop, for example. And I know that there are catalogs with such for medical supplies that could assist people with different types of problems. And of course, surgery could be done to repair the joints, to fix the contractures, to strengthen fingers so that the disability is not so significant. Tendons could be repaired, joints could be replaced. We are very invasive in this day and age. Nerves could be also taken from one place, put in another place. So there are a lot of things that surgeons could help with. Of course, surgery is always a last resort for such things, and that's why physical and occupational therapy early on are very important. All right, so some more food. So these are simple traditional dishes. This is on the right, your right side, Sjogren salata. Sjogren salad, tomatoes, cucumbers, peppers, onions, and of course on top of that, feta cheese. Just oil and vinegar. We don't use dressings. Oil, vinegar is fine, and salt. And on the left, shish kebab and all kinds of different. They're very similar to Turkish cuisine, to more Mediterranean, Arabic, but excellent meats there. And it could be done very quickly. So this is, oh, it's working now. Oh, look at that. So this is a major cathedral. This is Varna, my city. Oh, a beautiful cathedral here. And this is an old castle in southern Bulgaria. Lots of history we have also. Unfortunately, people don't know. Yes?
Are you also sponsored by the Bulgarian tourists?
Yeah. People don't know about my country, and patients usually ask me after that, where are you from? That's why I started putting this. And also it's good for, you know, kind of to switch topics from one to the other.
They really do it new when you provide all this food.
Yes, and now we're all So lupus, another big disease, autoimmune disease, again, multiple organs can be involved, including skin. And as you can see here, I'm showing a patient with what we call heliotrope rash. Heliotrope means, helios means sun. So any areas, just like with dermatomyositis more or less, areas that are exposed to the sun, scalp, neck area, the décolleté. And again, it could be overlapping. Symptoms could be overlapping with other disease. When we see this rash, we know, oh, there is something wrong, and we will look for lupus or dermatomyositis, but they could coexist also. I have patients with both. Symptoms can develop suddenly or develop slowly. Again, flares, remissions, or just steady disease. Fatigue, fever, joint pain, stiffness, and swelling. Have you not been hearing this since the beginning of my conversation? So that's why it's overlap. They could have Raynaud symptoms, shortness of breath, chest pain, dry eyes, confusion, memory loss, and about 10% they can also have myopathies, weakness of the muscles. And some people are predisposed to lupus. Their families, in fact, their families kind of cluster different autoimmune diseases, and one family member can have one, other family member can have other autoimmune disease. Sunlight is a potential trigger infections. Infections, as you know, they trigger many things because during infection, our immune and the capability of our immune system to fight kind of goes down, and then a lot of things, the bad guys in the body, the antibodies, they kind of try to take over. Medications, very important, that just like there are medications that can provoke muscle weakness, same way medications can provoke lupus, hydralazine, quinidine, isoniazid. So hydralazine is for blood pressure, quinidine for the heart, isoniazid for tuberculosis, propionamide for heart rhythm. And there are medications that can cause worsening, antibiotics, hormones, dermatologic medications, seizure medications. And many, if you stop the offending medication, symptoms could get actually better, but many times if this actually provokes autoimmune reaction on its own, because medications could also cause autoimmune disease, and that could persist, just like with some myopathies provoked by medications, the statins, for example, cholesterol-lowering medications, that could start an autoimmune process within the muscle. And then even if you stop them, the problem still persists. Risk factors common in African American women, Hispanics, Asians. It affects all ages. Children can have lupus too, 15 to 45. Complications, the kidneys are the major problem. These people develop kidney disease, in some of them even requiring hemodialysis. Nervous system, headaches, a lot of non-specific kind of symptoms, but lupus can affect the blood vessels inside the brain called this vasculitis, and vasculitis is inflammation of the blood vessels. If there is blockage of the blood vessels, patients could have strokes, right? On top of that, they could have problems with increased propensity to make blood clots. We call it hypercoagulable state, and with that hypercoagulability on top of that increases the chances for strokes, heart attacks, and miscarriages also in pregnant women. They could develop anemia in addition to the problems with clotting, lungs inflammation, bleeding into the lungs, and inflammation of the heart coverings, so heart attacks and, like I said, stroke and heart disease. Infections due to the disease itself or the treatment, the immunosuppressants, low risk for cancer, vascular necrosis. This is damage to the bones that could cause not only pain but also limping and fractures, collapse of bones, and the pregnancy complications, like I said. And that's where, even I as a neurologist, I'm not a gynecologist, but we ask patients if they've had miscarriages, or if their sisters had miscarriages, or if their mothers had miscarriages. That could be a clue that there is a hypercoagulable disease running in the family. Again, diagnosis, put things together. Symptoms could be non-specific and from all over the place. Sometimes even patients, now unless they have the heliotrope rash, this butterfly rash, they can imagine, I have fatigue, my joints hurt. They may be even considered like crazy because they're non-specific, just like with many of the diseases that I'm describing. But then we do the lab tests, we do, of course, the antibodies, x-rays, then biopsy is very important if somebody has kidney problems, and I'm not talking, my kidneys hurt here, I'm talking about bad worsening of creatinine function, urine output, and whatnot, to determine if there is need for assistance in the clearing, like hemodialysis, for example. Skin biopsy of a lesion. It's very easy. Actually, the easiest thing, even with dermatomyositis, to take a piece of skin instead of taking a deeper biopsy. There is no cure, like in many of the diseases, but there are disease-modifying medications. Again, there's non-steroidals, plaquenil, which is anti-malarian medication, steroids, different immune suppressants. And you know that, just like with myositis, one may not work for one person, but may work for another person. So there is no recipe like for the foods that I'm showing you here. It's very individual, and the physicians, indeed, they may have preference for certain medications, but they decide together with the patient based on comorbidities and other things. There are biologics, Benlysta again, rituximab. You're familiar with the rituximab. All right, so we're coming to more complicated dishes. Stuffed grape leaves and stuffed cabbage rolls. I can make those too. Stuffed grape leaves with, Greeks have those too. Middle Eastern also. Meat or vegetarian. And same with the stuffed cabbage rolls. Mixed connective tissue diseases. And again, this is, on the right is a picture. We have the highest mountains in the Balkans, and they have beautiful lakes there. You see, you may think it's Switzerland, but it's Bulgaria, actually. And one of the most beautiful monasteries in that same region, Rila Monastery. Beautiful one. So these are again autoimmune diseases, mostly women, middle-aged young women, and they could be combination of things. They could be having signs, skin changes very similar to scleroderma, lupus, or polymyositis in general. And that's why it's called also overlap disease, because it shares features from many others. So the early signs, of course, could be anything that I mentioned. And later signs, there could be organ damage. So this is what we want to address and monitor early on. That's why it's important to go to the primary care, check the blood counts, because the blood counts will tell us how the kidney, even when we do CBC, right? CBC, we make judgment how the blood counts are doing, how the bone marrow is producing, how the platelets are. With the CMP, we get an idea about the electrolytes, we get the idea about the kidney function, the liver function also, very important, and the blood sugar, of course. Steroids are used, like prednisone or other immunosuppressive agents. Malaise, fatigue, mild fever, Raynaud, swelling of the fingers, muscle pain, joint pain. See, it's the same theme that I've been talking about. And some of them may even have rash on the knuckles, so it may look like dermatomyositis, right? With the Gottron hypothesis.
You might cover this, but do you have all of the symptoms of all of the mixed diseases, or do you have like maybe this of scleroderma, this of lupus, and polymyositis?
Yeah, I'll repeat the question because this lady asked me to repeat the question. The question was whether they have all of the symptoms or only some of them. And the answer is maybe some of them, maybe all of them. So that's why it's not one type of presentation only. And that's why when the rheumatologists see those people, these are not people seen by neurologists. These are the people who go first to the primary care physician. And because of these joint problems and swelling of the joints, they are referred to the rheumatologist. And the rheumatologists start doing all these tests, right? The ANA, the Sjogren, and they may find one or not other lab test. They cannot pinpoint exactly what it is, and they call it. This diagnosis, by the way, didn't exist years ago when I was early in my career. Then they started because they couldn't, because they were seeing that there are patients who have the symptoms, but they couldn't put them in one category. And that's why they put them in this category where it's kind of a wastebasket of all these other diseases. So again, pulmonary hypertension, if there is a lung involvement, interstitial lung disease, this connective tissue accumulating in the lungs, heart disease with a large heart, kidney damage, digestive tract. But not all of them could exist in one patient. Only one of them could be there again. Anemia, iron deficiency anemia, Raynaud, and hearing loss. These people could also have hearing loss. All right, here's me. Look at this. So this is sujuk, dried sausages, and we made last year with a bunch of friends. See, we hang them here to dry in their garage. And we eat them. So this is also very typical for Bulgarians to dry sausages for the winter. Raynaud disease. So I want to tell you, because this is not only a tourist trip, but also historic knowledge. In Varna, in my city, was discovered the oldest gold in the world, which is 4,400 to 4,100 years BC. We didn't know that. Actually, the Americans dated it, and they showed that it was the oldest gold, the Varna gold treasure. And this is the Panagurishte gold treasure. We have many gold treasures, silver treasures that travel around the world. You guys are familiar with Italian and Greek culture, but these are beautiful pieces. 13.5 pounds of 24 karat gold for 400 to 300 BC. Raynaud. So we talked earlier about the Raynaud phenomenon in patients who have other overlap diseases. During attack, cold or stress, fingers could get 5 minutes? Yeah. They can get white, and then they can turn blue as you start warming up. Circulation improves, but once the circulation improves, they may become very painful. Fingers, toes, nose, and lips. That's why it's very important in people who live in colder climates to protect, to use masks. Mass fashion is out of the window in people who have problems with this, because these are the smaller arteries, and the smaller arteries, they can spasm, and like I said, with prolonged spasm, that could cause an infarct in that piece of tissue. An infarct is dead tissue, actually, necrosis, and when the tissue dies, you have to cut that tissue, right? You don't want to go that way. Women are more affected, and treatment depends on the severity, but it could be disabling, because like I said, if you have to go to work and use gloves, it may work for one type of job, but may not work for other types of employment. There is primary Raynaud's and secondary. The primary is this kind of, it's less serious condition where women, mostly women, just have this problem with their fingers getting pale in colder temperatures, and it's not associated with other autoimmune diseases. The secondary Raynaud is the one that is caused by all these other lupus, scleroderma, and all these diseases that I was telling you about. And the causes connective tissues, lupus, Sjogren's. There is also other type of disease, maybe you've heard of it, called Buerger's disease. These are people who are smokers, typically men, smokers, and their arteries kind of get blocked, but not by atherosclerosis, this cholesterol plaques, but from within they kind of close. And many of these, actually my grandfather had that, and they have to cut the legs. Because the tissue died, the leg dies, for example. It's not like the diabetic patient type of gangrene, but it's dry gangrene. And it's a very nasty disease. Years ago, back in Bulgaria, I had a patient with 4 limbs that had to be cut because of Buerger's disease. Carpal tunnel syndrome can be also a reason for this finger color change. People who have repetitive use of their hands, occupational, for example, construction workers who use different tools that cause vibrations. Smoking is a big one there. Actually, Buerger's disease that I was telling you about was the disease of the male smokers, but it could be of people who never smoked. Injuries, medications sometimes, many of the medications can cause Raynaud's phenomena. For example, headache medications, the triptans for treatment of headache, they cause vasospasm. Ergotamine is also that we use for treatment of headaches. Chemotherapies, cold medications. Tissue damage, I said, gangrene. So prevention, warm clothes, use gloves, use masks, use different heating pads. And I know that they're chemical, not only the ones that you can use to keep the patient to do a test, but ones that are longer lasting. Those of you who have done hunting, you can put in your shoes, you can put in your pockets. Air conditioning can trigger attacks, like I said. And something else, insulated cups or insulated bottles. Because if you have to carry your cold drink, that may provoke the symptoms and discomfort. Diagnosis, they do all kind of, they look with special tools to look at the blood vessels. Of course, immune tests are done. Arteries can be studied. Treatment, prevention again. Medications, we use medications that open up the blood vessels. I'm stopping, I'm almost done. Vasodilators, creams can be used, botox injections can be done, and nerve surgery. Bulgarian feta is better. And these are the diseases that I covered. And just out of curiosity, how are these animals related to myositis? I asked it, I've been speaking for myositis meetings for 10 years. I asked this question: Mediterranean quail and parrot, blue hamhead parrot, parrotfish. Do you know how they're linked to myositis? If you eat them, they can cause rhabdomyolysis. So folks with folks who have myositis should not be eating Mediterranean quail, Mediterranean. And this, I don't know where you can find this, but blue hermitage parrotfish, what this is. And this is a nice table with Bulgarian foods, and I thank you for your attention. The journey for overlap diseases in Bulgaria. Are there any questions? Okay.
In a couple of the different indications of different overlaps, you mentioned bone marrow or involvement with bones. Could you elaborate on that a little bit more and what you would see and what might be particular things?
Yeah, bone marrow. So to repeat the question for the lady here, she asked the question whether the bone marrow gets involved in some of these diseases, and if I elaborate on that. So bone marrow, how do we know that bone marrow is involved? Bone marrow can be affected not only because somebody has cancer, but because there is a chronic disease there. And there are three lines that come out of the bone marrow. The red blood cells, so people who have affected red blood cells production will have anemia. So that's why we test the CBC. And the CBC can tell us, is this iron deficiency anemia, or is this, which usually causes the blood cells to be small, the red blood cells, we call it microcytic anemia, or is deficiency of B12. For example, folks, it's not necessarily a problem with the bone marrow, by the way, that's why labs are needed. Because if people have problems with malnutrition, remember I was telling those who have GI problems, they may have trouble actually absorbing vitamins, and vitamin B12 is a major vitamin that we get through the food. So it may not be the bone marrow damage from the chronic disease, but it could be bone marrow insufficiency of supplements to produce the hemoglobin and the red blood cells.
So you're talking about cause, but like maybe go into what they would see on what they would see on a scan or something
On a scan?
of the bones, like the femur.
Oh, okay. So are you talking about osteoporosis or the bone marrow production? Because you were asking about.
Well, I don't really know.
The bone marrow, we do not do scans for the bone marrow. For the bone marrow, to have an idea whether there is bone marrow damage, is the labs. So if you have problem with anemia, they may not be bone marrow biopsy, for example, take a piece of the bone. But if you have problem with the white count, let's say the white count is super high and you don't have any infection, they may take a piece of bone. If the platelet count is too low or too high, they may do that. But if you're looking for osteoporosis, for example, you just do a special bone scan to determine if there is osteoporosis. And we all women, particularly after a certain age, we must have that on a yearly basis. But CAT scan, X-ray can tell you whether there is some problem with the bone. But it's the dedicated bone scan that we do for osteoporosis. If we suspect cancer of the bone, there's a little bit different PET scan. Maybe I'm not understanding.
Well, no, I'm asking some key questions. And so what would you actually see on those scans?
Well, you can see the osteoporosis, the thinning of the bone. And there are different points in the body where they are the most important. For example, most important, not because others are less important, but where you can have fractures. And these are the hips and here in the back. So because these are the main ones. And they look at numbers. That's why it's good to have a baseline. It's good to have your bone scans done in the same machine so that they have the same baseline value on it. And they would use different numbers. And I'm not a specialist in that, but they tell you for your age, this is how much bone tissue you should have in your bones. So that's what they would see with the imaging study. But if you're talking about, fractures, they may see fractures on the X-rays. But if you do a PET scan, that will show different activity. If there is a process in the bones, it will show increased activity in the bones. So in other words, the radioactive material will be shining. Okay.
I have a quick question. Do you ever use the term Crest syndrome?
Yes.
Scleroderma?
Yes.
What is Crest syndrome also known as limited scleroderma?
So CREST is, because it also involves the Raynaud syndrome, the esophagitis, the skin, so it's a variant of that. And it's just an abbreviation of what the different components are.
So that's still clinically used?
It's still, yes, it is, yes.
I have a question. The slide that talked about the lung involvement.
The what?
The lung involvement.
Okay.
One of the things on there was collagen with the thickness. And yesterday at the nutrition meeting, somebody asked about collagen supplements. And the end result is that it could be everything. But what I'm wondering is that different? I mean,
Yes, it is very different. That, yeah, it's still okay to take those supplements because they're not gonna go into your lungs. That, the production of the connective tissue in the lungs is because of this inflammatory mechanism. But it's, you still have to take care of your bones because of the susceptibility of the bones to different medications and even aging processes taking place. It's not gonna harm.
So collagen supplements are okay?
Yeah, they're okay.
Okay,
Yeah.
that was the question.
Yeah, yeah.
Right.
Anybody else?
Yeah, she's the one in front.
So,